moving from physical individual health to mental health, we now will turn to a conversation that I recorded earlier today with the leadership team of Violet. Violet helps to connect trans people with competent mental health care services in a way that recognizes different income levels, different insurance coverage levels, and other intersections that are important to us and important to our mental health. That conversation was with Gaurang Choksi and Nikiforova. And as I said, I did that earlier today. So here's my conversation with them. Gaurang and Kay, thank you so much for joining us.
Hi, Imara. Thanks for having us.
Thanks for having us.
Of course. My first question is, why do you think mental health, or how is mental health really important for trans and gender nonconforming communities in a way that's different for other communities?
Yeah, absolutely. Kay, do you want to take this one?
Yeah. So I think for our community, oftentimes there's so much additional difficulty with society around us, and that can create a tremendous amount of pressure on mental health and on well-being. And just having to navigate the systems within which we exist can really exacerbate some of those difficulties. But for me, there's also a tremendous amount of joy in it. And so being able to highlight that as part of our experience as well is really important. And being able to address both the difficulties and the celebrations is a really big part for us.
I'm sorry, were you going to say something, Gaurang?
Yeah, I was just going to add from kind of the interviews and the personal conversations we've had with our clients too. Another big one is really just we're asking individuals to find providers that are best for them and afford fairly expensive providers at a time where there may be other struggles already going on. And so I would say just the logistics of America's healthcare system really makes care difficult to access as well.
Right. And so in that, what problem is Violet trying to solve? What are you all tackling with regards to mental health for our community?
Yeah. For me personally, and Kay and I, again, we met at Oscar, so we spent a lot of time together even before building Violet. One thing we really care about is looking at clinicians as humans. So we really want to make sure we can actually help people find, whether it's a therapist or a psychiatrist, somebody that really sees all of your identities and can speak to all of your identities. So for us, the way we're building Violet, it's to help people find your therapist that actually sees all parts of you. The one thing we don't want is to say, this doctor is great for somebody that has this identity, whereas this doctor is great for this identity. With Violet, people can actually come to us and showcase and tell us about all of their identities, and we help them find the doctor that's best for them.
Mm-hmm. And, oftentimes we talk about when seeking mental health treatment, we're really the LGBTQ plus community is one drop down. And the community is not a monolith. And for trans folks seeking care, I've seen just so many members of my community, so many people that are close to me, just not even try to get care because they were so worried about the reception that they're going to have from the mental health provider, from the therapist. And people have countless really negative experiences. And so if you're coming to somebody with this vulnerable part of you, mental health is a very vulnerable part. We share our stories, we share our history. And to have this negative reception, it really doesn't make anybody want to seek care. And so we are going through and rigorously making sure that when the person finally steps into therapy, when they're able to seek treatment, the person is not only going to be accepting, the person is not only going to understand them across the spectrum, they're going to really help them thrive as people and not have the additional stress of having to worry about what my therapist is going to say. Are they going to say something negative about my identities? How can they celebrate me instead?
Mm-hmm. Does your service, which is designed to make it easy for TGNC people to find competent mental health services that also intersects with other identities, so does that come out of a personal experience that you had? I mean, you mentioned that you both worked at the health provider Oscar. It would seem to me that after that, you could have started any type of mental health service, any type of healthcare service that you might have wanted to. Does your desire to enter into this space come out of something personal as well?
It does. So both Kay and I are immigrants as well. And along with being parts of the queer community, we've had numerous conversations about how so much of the healthcare system forces you to pick one part of your identity and receive care just for that one part. And that was something that we thought was always really awkward, where you have to hide parts of who you are and then go to doctors that only support other parts of your identity. So with Violet, what we're focused on is making our clients really feel comfortable and sharing all of the identities that they want to share and finding clinicians that can speak to every single one of those. So our most popular search right now, or most common one, is individuals that are part of the queer community that are looking for care from a queer competent therapist, but they're also individual or people of color who are looking for BIPOC intersectionality support. And so we help our clients with this search find therapists and clinicians that are really culturally competent at both the queer community and for the BIPOC community.
And on my end, it's tremendously personal. I've tried to seek care and I've not always succeeded in that amount. I think for me, having been in the healthcare space and the tech space, leaving that, we could be doing anything. And I think some of the best, or at least most important ideas are the ones that come not only from a good idea from, the healthcare perspective or the system perspective, it really comes from something that we both experienced. And so intimately so, this really is coming from our experience, not being able to get the care that we want. And even having experiences of not telling my providers my pronouns because they were the only person who I knew that could do that procedure. And I was really worried about losing them. And so it wasn't a pleasant experience. And yet to get care, I had to strip away all of these parts of myself. And that felt terrible, but I didn't know anybody else. And so I don't want anybody to go through that experience. We don't want other people, Gaurang has some stories about PCPs and we talk about these on a daily basis of what it's actually like.
On that point, in what ways is Violet working to ensure that mental health care services and the ability to seek competent care is accessible to everyone? We know that there's a range of possibilities in terms of whether or not insurance covers mental health services or not. Some people have insurance, some people don't have insurance. There are all these different types of insurance types. How does your service seek to kind of bridge or ensure accessibility?
Yeah, we spend a lot of time talking about that because, to your point, healthcare in the US is really broken. Some of these prices are just egregious, and it turns a lot of people off, and especially members of the queer community, that really there is economic barriers to accessing care. And so one thing we've been doing is every single clinician that we vet and make sure is a really strong fit for our platform, meaning they're culturally competent, we also ask them if they want to give back to our community through discounted slots. And so typically these are called sliding scale slots, and we formalize them. And so now on our platform, some of the therapists we work with, they offer slots as low as $25 a session. And what's been amazing is seeing the feedback from the therapists themselves. We've had individuals tell us that, hey, typically I've worked with individuals from the corporate America lifestyle, and it's been amazing actually working with other individuals from the queer community that I can actually reach and learn a lot from the client themselves. That's the feedback the providers have shared with us.
Yeah. And first, it's also important to provide subsidized care and additional free support, specifically for TGNC folks. One of the things that we've had almost since the beginning is a running TGNC support and skills group that meets every other week, and it's completely free. It's for the community. Folks can sign up. It's run by an incredible TGNC facilitator, and people come and get support. And I think right now during this time, we're not able to go to the places where we oftentimes seek support. I'm not able to go to a community center. I'm not able to go to my in-person group. And so it was critical for us to be able to offer something, but also offer something free, where people can just show up and get support and get community and get the skills, and to be able to bring that out into the world. We also have kind of a micro community around that where people are super engaged on a daily basis, sending resources, talking to one another. And it's just been really amazing to see, and something that we feel really passionate about providing.
And how do your providers, the clinicians, feel about this particular service? That is to say, what do you think has attracted, I understand what's attracted users or people seeking care to join and be a part of your network, but why do you think clinicians seek out and want to be a part of Violet?
It all goes back to our community. Therapists have been inundated with startups reaching out to them, especially with the pandemic happening and all of these mental health startups coming up. But the feedback we've heard was they haven't seen other startups that are explicitly catering to our community. And something that they really love is we send them exactly the clients they want to work with. So we have one specific therapist who came to us and highlighted that, hey, he wasn't actually looking for additional clients, but because of the fact that we wanted to send him exact members of the queer community that he wanted to work with, he opened up a few additional slots to work with those clients. So for us, it's 100% about the community, and the therapists love the fact that we're able to help them connect to individuals that really deserve care within our community.
Mm-hmm. And we often get feedback of, I don't work with anybody. I have enough patients, and yet they want to partner with us to be able to provide care to members of the community they might not be able to otherwise. In addition, when we actually get to know our therapists, we know a lot about them. We know about their lived experience. We ask their pronouns. We ask their identities. We ask for, who they feel comfortable working with. And that's really important because, I do clinical work, and I very rarely feel like I'm seen as a person. It's just kind of this drop down. And so it's really, really important to be able to be seen as a whole, person coming into this clinical interaction.
And lastly, right now, Violet is not yet nationwide or available in everywhere across the country. And so I'm wondering what the plans are for increasing your reach and making this service available for everyone.
Yeah, absolutely. I will preface by saying we're pretty young. We've been around for just under a year, and we really wanted to get New York right. New York City is the home to the most amount of queer folks, and we knew that it was the best city in the world to actually figure out how to best help our community. And the last 12 months have really taught us a lot. And so we're slowly starting to think about what other markets to go to and what other frankly, how do we use technology more to actually reach and scale more members in other cities around the world?
And specifically for trans folks, we have people coming to our support group and skills group from across the country. I think we even have somebody from Canada, so we're already being able to reach people. And now we've also rolled out some library resources. We're going to be putting out more and more content for folks to be able to read at home while we're able to scale on a larger basis.
Amazing. Well, thank you so much for taking the time to join us for Lives at Stake, our last Lives at Stake. And thank you so much for the role that you're playing to try to make mental health services more available, accessible, and easier for our community. And I know that I speak for a lot of people to say that we wish you all the success in that and look forward to your growth and what more you're able to do.
Thanks, Mara.
Thank you so much for having us on.
Thank you. Thank you so much.